We're seeing a summer COVID-19 surge right as kids are preparing to go back to school. The CDC says this spike is the highest it's seen in the last 2 years. 7 News Detroit reporter Jasmine Barmore speaking with experts and parents about keeping children safe from COVID.
COVID cases are on the rise again. And with back to school right around the corner, I'm out talking to parents to find out if they have concerns on sending their children back to school or if the regulations that are already in place is enough to keep them safe. Alonda is a mom of 2 kids. She says since COVID, she doesn't allow them to go into public places without a mask on, including school.
My personal option is to make sure that they're wearing masks, they have sanitizers.
It's not wrong to wear a mask.
Dr. Widener says she has begun to see an uptick in COVID cases. She says the symptoms are the same as a typical cold, and she doesn't expect for the cases to decrease with school going back in session.
We know that schools are the wonderful germ homes. And so just what should we do are really the questions that I'm hearing people ask more than anything. And then also what to do in terms of the COVID vaccine for individuals that have chosen to get it. What are the recommendations and what we should do?
What should parents do?
So if they've already received the COVID vaccine, the recommendations right now for the CDC is that if it was prior to September of last year, that they should receive another, so an updated or a booster vaccine.
Shane Dawkins is a parent of a soon-to-be 3rd grader. He says he isn't concerned about the COVID surge since his child is vaccinated, but if the school says mask up, his child will follow suit.
Mask on, I feel that's up to the school's discretion, because it depends on how the teacher feels about teaching in front of the classroom with a bunch of kids, not knowing that they're sick or whatnot.
I would advise that when teachers have students in the classroom, they should be aware if there are any underlying medical conditions that particular student may have, because it may have implications on what steps we need to take in terms of preventing or when we should be concerned for that particular child.
Currently, the nation is relying on wastewaters to measure the COVID levels due to the many different ways to test for the virus outside of a doctor's office. And while Dr. Widener says COVID today is far different from when it first surfaced, it can still make some children very ill.
So individuals that have underlying chronic conditions, especially those who have respiratory or heart issues, that's going to be where we will see the worst cases of COVID-19 at the current state.
I'm a lot comfortable with the mask. I'm a lot comfortable. My son does not play about the mask. He knows that's supposed to come off his face. He knows it has to at least cover his nose, under his chin. Yeah, he don't play about that mask.
In Detroit, I'm Jasmine Barmore, 7 News Detroit.